everyone, welcome back. This is Theresa Callard-Moore, continuing to read BridgeIT, the Integrative Medicine Approach to the Healthcare Crisis in the United States. Today we're moving on to Chapter 15. We will always have Paris from the movie Casablanca. I have many beloved people living in Europe because I've hosted several exchange students. I was in touch with them early in the coronavirus crisis and was preparing my family for the end of what was to come. We can see in the event of an international crisis that will overwhelm and damage our healthcare system. How do you think our private pay healthcare system will compare to the effects of a national healthcare system? They both have devoted healthcare staff and facilities. The fundamental difference comes from a perception of healthcare costs. We will be facing an economic fallout from this pandemic that will change our financial plans and securities that we all once had. Before the pandemic, I asked my Italian daughter what she makes at her job. She answered with a number. Then I asked her if that was before taxes or after taxes. She said they don't even consider the number before taxes. When they speak of a wage earned, it's only after taxes. I'm sure that's to reduce the 50% paying of taxes. However, they have found a way to reduce that pain by changing the focus of their income. This also allows them to budget more accurately, and they have universal health care, plus take 4-week holidays. We in the United States see it very differently. If we work in a job that provides benefits, which I do not, we look at the portion that we're paid. Now, if we're doing true math, we would consider the portion of our employer pays for our benefits that we never see. Then our total pay minus the cost of our insurance, local, state, federal taxes, and other fees, that doesn't even cover the deductibles and copays. This chapter goes right into healthcare math, so I'm going to continue on to the next chapter because this is healthcare math. Because we've relied on the insurance companies and our employers to cover our health care, we have forgotten how to do math. We only calculate the number that we see in the bills in the mail, which can be very high, I know. But look at the real numbers, not just copays and deductibles. For example, my husband has a pretty good insurance coverage, and I'm self-employed, so I don't have any insurance coverage. He gave me permission to post this, so let's look at the real math. And if there's a way, I'll try to paste this picture onto the YouTube clip. Let's say he gets paid $69,692. The company pays for some benefits, $28,532. The gross income then is $98,224. Which we don't even think he makes that. So that sounds awesome, right? But here's the rest of the math. Minus employee deductions for all the insurance coverage, his copays and all that. Not his copays, excuse me, his cost is $16,565. Then taxes, $3,059. Minus other taxes that we have to pay, obviously, $21,825. So his real net income is $56,775. Now let's go on. Now we have to look at healthcare. So we take that number, $56,775, minus deductibles. On average, we pay $2,500, minus, excuse me, 20% copays for the year, $5,870. The overall out-of-pocket health care on a good day, I mean, this is not us being sick, this is just a normal everyday, is $8,370. So if we look at his real income, $56,000, and we take away $8,370, he really makes $40,035. So what I'm looking at here is how we actually need to budget our life, right? So if we're going to buy a house or if we're going to buy a car, it's really half of his income. What he thought he makes, once we take out all the taxes and all the healthcare costs, it's only half. When we went to go buy a house, they said, well, let's take your cumulative amount of money, what I make and what he makes, net, I'm sorry, gross. So before all those taxes, and then double it, then times it by 3. So they're saying we could afford a $600,000 house. There's no way I can afford a $600,000 house. We can't afford that. We have car payments and house payments and medical costs. So that's the kind of math that we're working with. It's so messed up. This healthcare math chapter is my favorite chapter in the sense that we really need to look at accurately talking about what our employers are offering, how much our taxes cost, and how much healthcare costs. Let me tell you another story. I was going to get an elective procedure, a surgery, and it was going to cost $7,000. That's the actual cost that they say it's worth. My insurance company said, oh no, we only pay, $1,500 for that surgery. Okay, so then I asked my insurance company, will you give me prior authorization and say you're going to pay that so I can get this elective surgery done? They said, we can't give you prior authorization for that because it's not always effective. So we can't guarantee that we're going to pay that. So then I went back to the surgeon's office and said, all right, if they don't pay it, you're going to bill my insurance first. But if they don't pay it, do I pay $1,500? And they said, no, you pay $7,000. What is wrong with this math? There is something clearly wrong with this setup. This is the stuff we need to be talking about. So when we're looking at what our healthcare actually costs, we don't even know. Is it this number or that number? We don't know. And it depends on how many providers see you. Are they in network, out of network? It's so confusing. By far, this is the most important piece I think we need to talk about. My daughter in Europe, she's very clear how much money she makes. She knows exactly what her expendable income will be, and she knows exactly what her healthcare costs are. We don't even know. So how are we to make good decisions and good choices or have self-nurturing about these things when we're trying to balance out buying a car, buying a house, affording our families? This is the kind of stuff I'd love to talk to you guys about. I really hope you enjoy this book and this chapter in particular. Give me your feedback. If you like what we're doing, give me a like, sign up to subscribe and hear the rest of the book. And most of all, I'm interested in what can we do about it. Thanks so much.